Glutamate is the principal excitatory neurotransmitter in the central nervous system, and its receptors, classified broadly into ionotropic, IGLURs, NMDA, AMPA, KNIT, and metabotropic, MGLURs, play critical roles in synaptic transmission, plasticity, and neural circuit modulation. Dysregulation of glutamate receptor activity is implicated in a range of neurological and psychiatric disorders, making these receptors attractive therapeutic targets. In neurodegenerative diseases such as Alzheimer's, Huntington's, and amyotrophic lateral sclerosis, ALS, excessive activation of NMDA and AMPA receptors leads to excitotoxicity, contributing to neuronal death. Pharmacological agents like memantine, an NMDA receptor antagonist, have been developed to mitigate this overactivation, providing symptomatic relief and slowing disease progression. Similarly, AMPA receptor antagonists are under investigation for their potential neuroprotective effects. Epilepsy is another condition where aberrant glutamatergic signaling contributes to hyperexcitability and seizure generation. Modulators of both ionotropic and metabotropic glutamate receptors are being explored to dampen excessive neuronal firing. For example, perampanel, a non-competitive AMPA receptor antagonist, has been approved as an adjunctive therapy for partial onset seizures. In psychiatric disorders, particularly schizophrenia and depression, alterations in glutamatergic neurotransmission have been observed. Targeting MGLURs, especially MGLUR2/3 and MGLUR5 subtypes, offers promising avenues for novel antipsychotic and antidepressant therapies. Agonists, or positive allosteric modulators of these receptors, can help restore glutamatergic balance, potentially improving cognitive and mood symptoms. Chronic pain conditions also involve maladaptive changes in glutamate receptor function. Both NMDA receptor antagonists and MGLUR modulators are being evaluated for their analgesic properties, aiming to disrupt pain signal amplification at spinal and supraspinal levels. While targeting glutamate receptors holds significant therapeutic promise, challenges remain. Given their widespread distribution and fundamental role in CNS function, non-selective inhibition can lead to adverse effects, such as cognitive impairment or psychosis. Therefore, current research focuses on developing subtype-selective modulators, allosteric modulators, and approaches that fine-tune receptor activity rather than completely blocking it. In summary, modulating glutamate receptor activity represents a versatile strategy for treating a spectrum of neurological and psychiatric disorders. Ongoing advances in receptor pharmacology, structural biology, and drug delivery are expected to refine these approaches, enhancing efficacy while minimizing side effects.